Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, right, what are these? Labeling. So let us label this. So this is looks like an arcuate scotoma. So this is an arcuate or Jerum's scotoma. Okay, then what is this? See, this is a blind spot. This is a scotoma. So this is actually a superior paracentral scotoma. Okay, so here the superior paracentral scotoma and blind spot met with each other and it forms a sedal scotoma. Now, when this sedal scotoma gets extended, it forms an arcuate scotoma. When this arcuate scotoma meets with one more arcuate scotoma here like this too, so it is actually a double arcuate scotoma or ring scotoma is present, but here there is a sharp angle border also. So along with this there is a superior central nasal step is present here. Okay, then here if you see, this is one scotoma, this is the second scotoma, both of them are not in same. See, this is one, this is the second, both of them are not in same arc. So there is a step like structure. So this is the step which is right angle, so both of them are meeting at right angle. So this is actually a Rowanese nasal step. Okay, so here most of the peripheral field is gone. So this is a tubular field which is present. So this is tubular field, and finally even the complete vision is impaired except that only the temporal island of vision is paired. So there is only temporal island of vision is seen. So what is this actually? This is actually the picture showing visual field defects in glaucoma, complete image. So in the glaucoma, these are the different visual field defects.
thank you and thank you for watching.